Hidradenitis suppurativa, or HS, the treatment options have changed vastly over the past decade. Now that there are biologics that are used for HS, I do find in practice we're changing the actual disease course for our patients and how much better controlled our patients are in terms of pain management with these areas. When you think about inflammation, think about our body as producing cells called immune cells. Those cells release different mediators to interact with other cells. We have these little flags on our cells, or different receptors that can actually take those mediators and figure out how your neighboring cells want them to respond. They might want you to respond with more inflammation, for example. In HS in particular, sometimes that inflammation is directed towards our hair follicles, and it can be frustrating because our hair follicles are a part of us. We can't get rid of those necessarily. The thought is if we can block some of those mediators so that cell doesn't respond with that exaggerated immune reaction, we can reduce the tendency for that inflammation to get out of control. As of now, the current biologics approved to treat HS tend to focus on TNF-alpha and IL-17. TNF basically stands for tumor necrosis factor. Those two mediators, TNF-alpha and IL-17, have been the targets of many of the biologics used for HS. It's also targeted. It's not just suppressing your immune system. This isn't like taking steroids by mouth where you just suppress your overall immune response. I tend to favor a lot of these medications because they're so much more intelligent. They're so much more targeted. They have a cell to go after, and if it doesn't have that receptor, there's no impact on that cell. So think of it as having the keys to understand which cells to work with and which cells to avoid. The current biologics used for HS tend to be injectables. There are some biologics that can be infusions as well. The frequency is generally dictated by which one you're on. The ones that are most commonly used for HS are generally administered on an every other week, weekly, or every 4-week process. I remember a time when we really were faced with a lot of challenges where we had very limited options to really control that pain associated with HS. So seeing biologics in practice has been a huge change. Our patients tend to tolerate them well, and we tend to see that their inflammation is under so much better control, which means their pain is under better control. And we are finding that jumping on them earlier and earlier in disease course can really prevent and reduce that tendency towards progressing towards that inflammation that triggers scarring down the road.